Good evening. My first impression of this female upon her arrival, is that of some sort of a mental disorder, which would probably be associated with substance abuse. Her behavior of screaming obscenities at the person that is trying to help her might indicate that her reality may be distorted and she is unaware of her behavior. The fact that she fell might indicate that she might be under the influence of a substance that is affecting her balance. These actions indicate that she is going through some sort of neurological imbalance. Patient bleeding, disoriented, combative, and hallucinating. When they took her purse, is indicative of abusing some sort of drug. Patient might also be going through a withdrawal episode. This would explain the shaking of hands, being upset, and asking for her bottle. Her appearance and smell is indicative of being in this kind of mental state for a long period of time. Short-term health risks would be slurred speech, vomiting, seizures, blackout episodes, impairments, visual impairments, heart attack, strokes, including overdose, panic attacks, paranoid, hallucinating, becoming irritable, being sad, depressed, or confused. Long-term health risks for this patient would be becoming schizophrenic, or acquiring another psychotic disorder, damage to her organs, which would lead to other health conditions, such as renal failure or heart conditions that might be associated with substance abuse, risk of getting Alzheimer's disease, overall body and mind problems will arise. I believe the patient's hands are shaking because she might be suffering alcohol withdrawal, and this is causing her hands to shake. Shaking of hands is one of the symptoms of alcoholic withdrawal. She might be a heavy drinker and is in need for more alcohol. This is why she kept asking for her bottle. She is experiencing hand tremors, irritability, anxiety, which are all symptoms of this withdrawal. Her confusion and combativeness is caused because it's probably been several hours since her last drink, and she might be a heavy drinker, which these symptoms are going to manifest. This patient is going to need several assessments because of the condition that she was found in. There has to be a neurological assessment to figure out why she is combative, disoriented, screaming. Also, she might need a cardiovascular system assessment to check her blood pressure, check for any abnormalities in her heart function, the urinary system assessment to see why there's a smell of urine. Make sure there's no infections in her urinary system. And a physical assessment to check for any other injuries that she might have sustained when she fell. Mental illness are both pharmacological and therapeutic methods that are used because there are several steps that need to be taken to properly diagnose someone with a condition. Taking in as much information is essential for an accurate diagnosis. Understanding the condition that has to be treated will give the doctors the information that they will need to bring that person back to good health if possible. They will know what signs and symptoms the patient will present. All this information has to be documented for insurance purposes and also for medical purposes. And all medical procedures have to be approved. I believe having this information is sufficient for the patient to receive good quality care. A good example of health insurance is the Affordable Care Act, which provides one of the largest coverages for mental health and substance use disorders. Because of this bill, most other insurance companies must cover preventative services such as depression screening, which seems to be a problem among society. Having the insurance companies cover these disorders will help minimize the stress of being in a financial burden.